I am Dr. Chidananda from Bangalore. Uh, I'm very happy to see all of you in the afternoon, and it's my first visit to Bangladesh. I'm very much impressed by your hospitality and friendly nature. Thank you for the opportunity, and I will share my experience, a few experience about the rhinoplasty. So I basically do rhinoplasty surgeries and as well as general ENT. Rhinoplasty is my passion. So I do more work on facial plastic surgery. So before you start the rhinoplasty surgery, you must know the basics like patient selection, preoperative evaluation, preparation for rhinoplasty. So you have to identify the patient. So which patient is benefited by rhinoplasty. You cannot do rhinoplasty for all cases. Whoever come to you, you cannot do like that. Okay. So always the success begins with careful preoperative preparation and planning. The time spent understanding the patient goal will be the time saved postoperatively. Very, very important. So it has a steep learning curve. So rhinoplasty, it has a steep learning curve. First you must know how to do septoplasty. If you are a ENT surgeon, if you are a plastic surgeon, or if you are a maxillofacial surgeon, so you must learn how to harvest the cartilage. Okay? And then you can do functional open approach septorhinoplasty. And then you can go for cosmetic rhinoplasty. And then you can go for reconstruction rhinoplasty. Okay? So you must know where you stand. If you are a beginner, you try to do septoplasty first, then go for an higher end like open approach, functional rhinoplasty, then cosmetic, like that. Okay, so you must know whom to avoid to do rhinoplasty. So body dysmorphic disorder, you know, body dysmorphic disorder, they are the crazy patients. They will not have any deformity, but they will have imaginations. So such imaginary deformities you cannot identify, you cannot see it, and you cannot satisfy them. Such patients you must avoid. Unrealistic expectation. Suppose if the patient is having dark skin, thick skin, and if the patient wants sharp nose, so which is not possible. So such patients it is better to avoid. And minor and imaginary deformities, a minor hump or minor depression, such patients you may not give the result. Or unmotivated patient. Suppose if the patient is not willing for surgery, the husband has brought the wife or some boyfriend has brought the girlfriend, so such patients it is better to avoid. Next, coming to the which patient are relative contraindications. They are not absolute contraindication, but you can do rhinoplasty in these kind of patients, but you should be very careful. Suppose if this is a revision case, you don't know what has happened in the first visit, first surgery, so you cannot guarantee, you cannot give 100% success as in primary rhinoplasty. Or disorganized patient, if the patient is not knowing what he needs, okay, he is not clear in his mind, such patients, and psychologically disturbed, depressed patients, or and some patients going for relationship, or pediatric age. So pediatric age, because the pediatric age, the child will be growing. So if you do rhinoplasty, you may land up in deformities. Okay, and then thick skin and acne. Such patients also you may not give good result because of the thick skin. Whatever the framework surgery you do, it may not manifest. So just I will show few pictures. This is a revision case where you can see this patient came with irregular deformity, irregular surface on the dorsum. This patient wants sharp and smooth surface of the dorsum. So this is again a risky case, but we can give good result in such cases. This is again a revision case, and this one more case. The patient has undergone septoplasty, so it has led to pseudo hump. Can you see the pseudo hump here? And there is a depression of the tip. This is again a difficult case. You may not get septal cartilage for reconstruction. Again, this is acne with a thick skin, oily skin, so you cannot give good result in such cases. This is again a thick skin patient. Okay, this is a patient with the bulbous tip, thick skin. This is one more case with a thick skin. So these cases you cannot give sharp nose. These patients came for sharp tip, which is not possible. Okay, you must explain to the patient that it is not possible. So one more case of thick skin. And coming to the pediatric age with congenital deformities. Sometimes you have to do surgery in pediatric age. Suppose if the patient is having discharging sinus in the tip and it is obstructing the vision. In such cases you can do surgery and you can give a good result like this. And in a pediatric age you may get most of the time the patient will be having self fall, road traffic accident. In such patients, if the patient come early, you can do closed approach rhinoplasty. You can just do with a finger fracture. You can make the framework in the midline. In this case, there is a framework is shifted to the right. Okay, so you can do rhinoplasty and you can make the nose straight. So can you see make out the difference between first picture and the last picture? Okay, next coming to the relatively difficult cases like congenital deformities or reconstruction rhinoplasties and cosmetics rhinoplasty to correct minor deformities and tip deformities and severe saddle nose. Such cases needs more experience, more skill. So such cases you have to take help of senior surgeon and then you can do you can give good result. I will show few cases who has minor deformities. So this case, this patient came to me having said that she is having a hump, so very mild hump. So she may not require rhinoplasty, but still she has come for rhinoplasty. So just I avoided this kind of patient. So one more case, she is having high expectation. She is having facial asymmetry and she want a facial asymmetry be corrected by rhinoplasty, which is not possible. Okay, so one more case, she is having minor depression. So again, we can correct it, but we cannot give guarantee that you can get a straight nose. And then asymmetrical nostrils. These are the tricky cases, but you can try. It all depends on your skill and your expertise. Next, coming to the congenital deformities like binder syndrome. She is having a short columella. So these cases needs a subnasal rotation flap. Then cleft nose. So cleft lip and cleft palate corrected noses, they will have asymmetrical nostrils. Again, these patients require rib cartilage or costal cartilage for the better result. One more cleft nose case, you can see asymmetrical nostrils. Okay, one more cleft nose. And some cases you get a patient who is not having lower lateral cartilage. There is no lower lateral cartilage in this case. In these cases require costal cartilage for reconstruction. One more case with underdeveloped lower lateral cartilage and very thick ala and columella. One more case with thick columella and ala. And then coming to the road traffic accident patient, these patients you can give good result by doing osteotomies, very good osteotomies, medial and lateral osteotomies, and you can shift the framework. And tissue loss patients, this is a dog bite case. So again, we can take a paranasal flap or forehead flap, dermoid sinus in an adult patient. Okay, next coming to the relatively easy cases. I will show few easy cases which you can give good result, like hump over the nose or saddle nose or caudal dislocation or wide dorsum or other correction patient. These are all relatively easy but tricky. So this is the case of hump over the nose. So you can just shave off the excessive bone and cartilage and you can give straight dorsum. One more case of hump nose. So one more case of hump nose and deviation of the nasal framework. These are all the C-shaped deviation of the nasal framework. This is a boxy tip. Tip is bulky. Then bulbous nose and the deviation of the nasal framework. So these cases you can give good result. The patients are relatively easygoing and they have less expectation and you can give better nose when compared to the complicated noses. Okay, and this is suppurative depression, then deviation, broad dorsum. In this case you can just remove the hump and do medial and lateral osteotomy, you can give good result. Okay, the small nose and the deviation of the nose, again broad dorsum and depression, the bifid columella. And this one more interesting case, this patient came to me having said that he is having nose block because of the tip drooping. So by just lifting the tip he can able to breathe. So such patients will be benefited by doing functional rhinoplasty. So one more case of deviated nose, shrunken nose. These are all the easy cases you can do and you can give good result. Okay, next coming to saddle nose. Saddle nose. Next I will talk a few things about body dysmorphic disorder because this is very, very important. So you must avoid body dysmorphic disorder cases to avoid complications. Okay, these patients will are preoccupied with some imaginary physical defect that others cannot see. Okay, so these patients, they themselves think that they are ugly. Okay, such patients are very dangerous patients. They will not be happy. Whatever you do, they will not be happy. Okay, they will have a peculiar symptoms like frequently comparing, ritualistic behavior, and they avoid social gathering, something like that. This is a typical case of body dysmorphic disorder. This patient he has undergone hair transplantation, brow lift, and then blepharoplasty, rhinoplasty, lip augmentation, and then dermabrasion. So many cosmetic surgeries he has undergone, but he was not happy. So he came to me for rhinoplasty, then I just refused him. Okay, next I will show few cases who are happy and some good result patients. So this patient came to me for nasal obstruction, but I have done both septorhinoplasty and this patient is happy. This is one more case with hump in the nose. So I have removed the hump and this patient is also happy. And this is one more case with cleft nose. The patient had asymmetrical nostril and that asymmetry has gone and the patient is breathing from both the nostrils. This is one more case with saddle nose. I used Gore-Tex to augment the nasal dorsum. One more case with hump over the dorsum. So after, this is before and this is after surgery. This is one more interesting case with hyponasal, eminasal hypoplasia of the nose. So I used a subnasal flap to rotational subnasal flap to give breathing both sides. Okay, just I'll skip few slides. So what is the take home message? So you must assess the mental health of the patient and motivation and the objective of the patient. Identify the patient requirement. Don't go as you like. You must identify what patient wants. So that is, this surgery is patient centered, not the doctor centered. And you must know where you stand. If you are a beginner, take a help of other senior surgeon and you can go for rhinoplasty. Okay, so I'll just skip few slides. Okay, so I will skip all these slides. Okay, you must know when you start the rhinoplasty, you must know how to take photographs. So you have to take in the 7 views: the frontal view, the basal view, and the aerial view. It is also called helicopter view. Then the lateral view, both sides, oblique view, both sides. So total 7 views. So then only you will come to know so many things about the facial aesthetics. So you will come to know what is the distance between the two eyes and the nose, what is the length of the nose. So many things you will come to know by taking photographs. And then you can assess. You can take the photograph, take a printout, and you can do assess. Okay. So these are the photographs. So when you take a photograph in the lateral view, you can see there is the chin is retracted. So this patient needs, moreover, the patient came that he is having big nose, but actually he needs chin augmentation. Okay. So like that, when you take photographs, you will come to know so what patient needs. Okay. Next, when you do the surgeries, you must know what patient needs, and if you are not able to do some of the things, you can take help of plastic surgeon or dermatosurgeon or oral maxillofacial surgeon, okay, and dermatosurgeon. So these you can take help. You must have an interdisciplinary approach to give better result to the patient. Okay. Next, coming to the next preoperative preparation. I will just go through what are the preparation you must have when you start rhinoplasty. So you must ideally you must do rhinoplasty in the early morning to have a good result, and admit the patient before night only, and anesthesia depends on the patient, and you must be ready with the instruments, bipolar cautery and suction. Okay. And then these are the requirements: antibiotic solution, infiltration, betadine, adrenaline. So these things should be kept ready before surgery. And you must have a trained staff when you start rhinoplasty. If you don't have, then you have to train the staff. Okay. Next, coming to the preoperative preparation by the patient. Okay, you must tell the patient. So you must be ready for the surgery, and you must give all the necessary information to the patient. Okay, then so I will show few requirements, like what are the splints and sutures required for rhinoplasty. So these are the aluminum splint I use for external framework, and this is the internal splint I use in between the splint, and I use pack. I don't use ribbon gauze. I use Myrosil pack for packing, and I use number 11 and 15 blade for incision, and I use Killian's retractor, what we use in septoplasty, and these are the various instruments used for osteotomies. So the humpectomy osteotomes and lateral osteotomy and medial osteotomy instruments, and the various seizures, and then these instruments for rib cartilage harvesting. And these are the instruments used for retraction. Okay, this is the instrument used for rasping. There is a rough surface here and a smooth surface. And then I use the suction elevator for septal surgery, and the D-knife and Killian. These are the Freer's elevators, and the needle holders. You must have 4 needle holders for different sutures. And then this is one instrument which is very important. This is called cartilage forceps. These instruments are very, very important to give good results. So if you don't have instrument, you must buy these instruments and then go for doing surgery. And the sutures. So this is one more important with reverse cutting. All sutures will have a code. So there is something called W9872 here. So you have to identify the code. Okay, so you have to write the code and then you take from the pharmacy. So this is a absorbable PDS suture, which is used to suture the cartilage. 50 Prolin for skin suturing, 50 Vicryl for suturing the marginal incision. And then you must arrange the instruments in such a way that you must not mix it you must not mix, because so many instruments are there. So always you must identify the instrument. Whenever you want, you can pick it. Okay, always you must have 2 trolleys one for the minor instruments, one for the solutions. So these are the solutions, betadine and antibiotic solution, saline. So all these should be kept in one big trolley. Okay, so always the nursing staff should stand to the left side of the patient. So if the surgeon is standing on the right side, and you must have 3 assistants. Okay, so always I ask the anesthetist to give head end elevation to avoid bleeding. It will reduce the bleeding. Okay. Okay, these are the preparations. Okay. So I will, this is the last slide of my presentation. So good results do not build good practice. Always you have to make the patient happy. Then only you will get a good practice. Okay, thank you. Thank you very much. And he is my professor. He is Professor Dongak Jung from Korea. So I learned rhinoplasty from this man.